Now let's talk about diagnosis through the nose color. As the entrance to the respiratory passage, the nose connects the inside of the human body directly with the outside world. Many acupoints are located on the surface of the nose. At the onset of an illness, the color and the physical form of the nose will change accordingly. Those tiny changes can help people diagnose for themselves what ailments are developing. Diagnostic nose reading refers to the method of observing the color and luster of the nose, its physical form, and behavioral changes in the course of breathing to determine the underlying ailment. It is an important component of TCM diagnosis. The nose is the orifice of the lungs and the entrance to the perspiration passage. The 5 internal organs all ascend their chi to the nose, a prime example of all visceral organs and tissues in the body. Each Zhang and Pu organ and tissue shares a corresponding site on the nose. For example, the tip of the nose reflects the health of the spleen. If the tip of the nose is red or shows some abnormalities, it may indicate problems with the spleen, as shown in the picture on the top page 42. The different parts of the nose correspond to the related Zhangfu organs on the nose. They reflect systematically and selectively the physiological and pathological conditions of the viscera. In this diagram, we see the points on the face where the lung, the breast, the heart, the gallbladder, the liver, stomach, and spleen are all pointed to the distribution of the corresponding Zhangfu organs. Now, the color of the nose. The nose is one of the more complete and visible parts that is representative of the holographic phenomenon of the human body. By observing the color changes of different parts of the nose, pathogenic changes can be detected in the viscera that corresponds to that part of the nose. The nose of a healthy person is bright and pinkish, similar to that of the ears, although with slight differences in shade. In addition, it is shiny and without pimples or bumps. If an ailment develops in the body, the color of the nose will change. The darker the nose, the more serious the ailment. Here we have a picture of a red-tipped nose. When the tip of the nose is red, it suggests excessive heat of the spleen and lungs. When it is slightly red, it means there is deficient heat of the spleen meridian. When the edge of the nostril is red, it indicates ailments in the intestines. Here we have a yellowish nose. When the nose looks yellow, it means there is damp heat in the body. If it is combined with a yellow color in the face and eyes, it is symptomatic of jaundice and is often seen in acute jaundice hepatitis. And here in this illustration, we see a pale nose. This is often a sign of deficiency of qi and blood. If the tip of the nose is pale with white millet-like bumps, this often indicates irregular menstruation. Here is a bluish black tipped nose. This is a sign of pain, often abdominal pain. Women with a great volume of dark red menstrual blood often experience painful menstrual periods. Now here we have a bluish nose. Scholars have found that people are likely to have the onset of ailments with the spleen and pancreas when their noses look bluish, brown, or black. Thank you for your...
Let's now proceed to interviewing. This time we'll talk about types of pain. First type of pain, soreness. This is a dull ache that usually occurs in the forelimbs or trunk. It is usually due to a deficiency condition or dampness. Next, we have pain with a sensation of heaviness. This is also a dull ache, but accompanied by a sensation of heaviness. This usually occurs in the limbs, head, or the whole body. It is typical of dampness or phlegm. The third type, we have distending pain. This is a pain accompanied by a sensation of distension or bloating. Chinese patients often actually say they have a zhang feng, that is a distending pain. No Western patient will ever use this actual expression, but this type of pain is very common in Western patients. English-speaking patients will usually say that they have a pain with a bloating sensation. Very often, they will not mention the bloating unless asked. It is therefore very important to elicit the exact symptoms and character of pain with a proper interrogation. A distending pain is typical of chi stagnation, especially of the liver. However, it should be noted that other organs may suffer from chi stagnation too, notably the stomach, spleen, and lungs. Thus, a distending pain in the lower abdomen usually indicates liver or spleen chi stagnation. In the hypochondrium, liver chi stagnation. In the epigastrium, stomach chi stagnation. And in the chest, lung chi stagnation, although this last one also may be due to the liver. So to summarize the areas of stagnation of chi, if it's in the lower abdomen, it's stagnation of liver chi. If it's in the hypochondrium, it's stagnation of liver chi also. If it's in the epigastrium, it's stagnation of stomach chi. If it's in the hypochondrium towards the epigastrium, it's liver chi invading the stomach. If it's in the chest, it's stagnation of the lung chi or liver chi. A distending pain in the head, such as that experienced during a headache or a migraine, is due to liver yang rising. English-speaking patients would usually call this pain throbbing rather than distending. Distension is both a symptom and a sign. That is, it indicates the subjective bloating sensation of the patient, but the bloating also may be felt on palpation when the areas feel distended like a drum. This is more easily felt in the epigastrium or lower abdomen. In gynecology, a distending pain is seen in dysmenorrhea from liver chi stagnation or premenstrual breast pain, and distension also from liver chi stagnation. Pain with distension is usually of a full nature. Distending pain is treated with warm pungent herbs that move chi. Thank you for your attention.
Let us go to disease and syndrome. The topic is modern Chinese medical practice. Generally speaking, both disease and pattern of disharmony are ways of defining nosological entities, that is, functional and organic disorders that occur in the body. However, disease in this context is a broader category of manifestation, whereas a pattern refers specifically to the underlying pathological mechanisms that bring the disease into being. A disease process can be divided into stages or parts, each of which would correspond to a pattern. Therefore, more than one pattern could underlie a given patient's presentation, or the pattern could change as the disease evolves. In modern Chinese medical practice, practitioners use the concept of disease to refer to conditions with clearly defined etiology, occurrence, pathomechanism, course, and prognosis. That is common cold, for example, common cold, dysentery, lung abscess, asthma, hypertension, etc. However, for TCM treatment to be effective, it must address the underlying process, that is the pattern of disharmony. At different stages in its development, any given disease may be the result of different patterns. Conversely, any given pattern may manifest itself in more than one disease. In this context, the disease entity represents the complete pathological process, whereas the pattern explains what is going on at any given stage. As mentioned earlier, TCM practice demands that the pattern of disharmony underlying a disease presentation be determined prior to arriving at a therapeutic principle and corresponding treatment. In the case of common cold, for example, a TCM practitioner must determine if the underlying pattern is invasion by wind heat, wind cold, or a number of other possible patterns. This conclusion will determine which treatment will be used. The disease name refers to a clearly defined pathological entity, and the pattern explains the underlying disease mechanism of the disease. Historically, TCM has identified a number of nosological entities whose etiology, occurrence, pathomechanism, and course are well defined and understood. These are also referred to as diseases, although they do not exactly correspond to diseases as they are known in biomedicine. Examples of these are atrophy disorder, wind stroke, painful obstruction, malarial disorder, wasting and thirsting disorder, and so on. These TCM diseases are also diagnosed and treated according to other underlying pattern of disharmony, which changes as the condition evolves. Conversely, TCM regards some isolated symptoms as separate pathological conditions, which are also referred to as diseases. Examples of these include headache, abdominal pain, insomnia, dizziness, painful urination, and chest pain. As always, within TCM, pattern discrimination determines the treatment. Thank you so much.
Differential diagnosis, both Western and Chinese medicine for chest pain. Western differentiation for chest pain. First, we have myocardial ischemic pain. This is chest pain felt under the sternum. Pain may radiate to the neck, lower jaw, back, shoulder, arm. Tightness in the chest, crushing or squeezing sensation, palpitations, pain duration over 20 minutes, continuous pain, unchanging intensity, unaffected by breathing or posture, rapid or irregular pulse. Second is non-ischemic chest pain. Causes may be reflux, esophagitis, esophageal spasm, heartburn, words lying down or while straining. Second is pulmonary embolism. Dyspnea may resemble hyperventilation and mild pain. Third, hyperventilation. Primary is characterized by dyspnea, patient often young, tingling numbness of the limbs with dizziness. Secondary hyperventilation, this is attributable to organic illness or cause. There is acidosis, pulmonary embolism, pneumothorax, asthma, infarction, and spontaneous pneumothorax characterized by dyspnea. Fifth is aortic dissection, characterized by severe pain, changing localization, may be signs of impending infarction, pulses may be asymmetrical. Pericarditis, pain is worse with changes of posture and breathing, friction sound may be heard. In pleuritis, there is stabbing pain when breathing. The most common cause of stabbing pain is, however, prolonged cough. Early herpes zoster, there are no heart changes. There will be rush, localized paresthesia. Ectopic beats, there is transient pain in the area of the apex. For peptic ulcer, cholecystitis, pancreatitis, clinical examination is needed to differentiate this from inferior ischemic wall pain. And depression, there is continuous feeling of heaviness in the chest, no correlation with exercise. Now let's go to Chinese differentiation for chest pain. Diagnostic questioning done according to TCM differentiation of chest pain or chest P. Stuffy sensation, fullness and pain in the chest. So there is stuffiness, mild discomfort, stress aggravates, relaxation or sighing relieves. So this is chi stagnation. Watery white sputum, chest rattles, greasy tongue coating, pronounced oppression, feeling of choking is phlegm stagnation. For heart, Qi or Yang deficiency, there will be mild pain or stuffiness on activity, shortness of breath, and palpitations. For Yin deficiency, oppression or pain with palpitations and night sweating. Next, we have burning pain. So if the diagnosis is fire, there will be irritability aside from chest pain, restlessness, red tongue, yellow coat, rapid pulse. Phlegm, heat, or fire. Chest pain is accompanied by stuffiness in the chest, burning pain, expectoration of thick sputum. For deficient fire from indeficiency, the chest pain is associated with burning pain with palpitations, dizziness, red, dry tongue, and no coat. Sharp pain is blood stasis. There is sharp, pricking, stopping, fixed pain, which is worse at night, purple tongue. And crushing, squeezing, twisting. This is Yang deficiency with cold stagnation, cold limbs, aversion to cold. Etiology in TCM, external cold invading the chest with pre-existing Yang deficiency, wrong eating, injuring the spleen, stomach, causing phlegm and blood stasis in the chest, Qi stagnation turning to fire, phlegm, and blood stasis, and old age. Zhangfu patterns. Excess patterns are phlegm, fires obstruction, stagnation of liver qi, heart blood stasis from yang deficiency, cold phlegm obstruction. And deficiency, we have heart yang deficiency with cold stagnation, heart blood stasis, heart, lung, and spleen qi or yin deficiency, and heart and kidney yin deficiency. Thank you for your attention.
Let's now talk about the Fu viscera and irregular organs, specifically the stomach. The stomach is located under the diaphragm. Its upper outlet, named the cardia, connects with the esophagus. Its lower outlet, named the pylorus, connects with the small intestine. The stomach has two main physiological functions. First is receiving and decomposing drink and food. Food and drink enter by mouth, pass through the esophagus, and are received by the stomach. This is why the stomach is known as the sea of food and drink. The food and drink are reduced to chyme by the decomposing and grinding action of the stomach. The chyme is then passed on to the small intestine where it is further digested. Although the stomach governs reception and decomposition of food and drink, it is only with cooperation of the transforming and transporting functions of the spleen that the digestive process can be completely smoothly and the essential substances from which qi, blood, and fluids are derived be extracted. Thus, the spleen and the stomach together serve as the foundation of acquired constitution. The digestive function of the stomach is carried out under the joint effort of the stomach yin and stomach yang. Disturbance in this function can lead to the poor appetite, distension and pain in the epigastrium, and acid regurgitation. Second, stomach's function is descending and transportation. The chyme that has been formed by the stomach must continue to proceed downward into the small intestine, where it undergoes further digestion and absorption. That is to say, the stomach harmonizes by descending. Only when stomach qi can flow downward freely can the stomach and the small intestine alternate between emptiness and fullness, and the digestive function remain normal. If stomach qi cannot flow downward freely, there may be retention of food in the stomach, resulting in distension, fullness, and pain in the abdomen, halitosis, and constipation. If stomach qi rises adversely, there may be much eructation, nausea, vomiting, and hiccups. In Chinese medicine, the stomach's function are often briefly referred to as stomach qi, but stomach qi has a narrower and a broader meaning. In the narrower meaning, it is a physiological function of the stomach. In the broader meaning, it is the entire digestive system, which includes the spleen and the sanjiao, in addition to the stomach. Chinese medicine attaches great importance to stomach qi and believes that stomach qi is the foundation of the human body. Ampleness of stomach qi ensures that all 5 zhang viscera are full of vigor, whereas its deficiency may lead to weakness of all 5 zhang viscera. Where there is stomach qi, there is life. Where stomach qi is absent, there is no life. In addition, normal functioning of the spleen and stomach are reflected in the pulse. This is a pulse that is smooth, even, and forceful, and it is neither fast nor slow. It is known as the pulse of stomach qi. As we see in the figure of the stomach regulates descending and digestive functions for maintenance of health. Now, the stomach receives drink and food and decomposes food. When there is disharmony of stomach and other organs, then there will be a failure of the descending functions, and this may result to a person's belching, acid regurgitation, nausea, vomiting, or fullness and abdominal pain, and could be others. Thank you for your attention.
Let's now discuss diagnosis according to Zhangfu organ patterns. This time, let's talk about excess heat in the small intestine. Heat from the heart or the stomach can be transmitted to the small intestine. The heat can then manifest with symptoms relating to the small intestine and also to the urinary bladder, with which the small intestine has a functional and Tai-Yang relationship. Let's take a look into its etiology. Emotional imbalances and influences can create heart fire. The excessive consumption of food and beverages that are energetically hot, such as alcohol, fried and grilled food, loud, hot spices, and so on, can create stomach and heart fire. The fire in these organs can be transmitted to the small intestine. The symptoms and signs are mental agitation or restlessness, insomnia, ulcers in the mouth and on the tongue, deafness, sore throat, formal in the chest, abdominal pain, thirst with a desire for cold drinks, dark scanty urine with a burning sensation on urination, blood in the urine, red face, the person talks quickly or talks a lot, red tongue with a red swollen tip and yellowish coating, fast plodding pulse, wiry in the left hand chirp position. The key symptoms here are abdominal pain, dark and painful urine, red tongue tip, possibly with ulcers on the tongue. The treatment principle is to drain heat from the heart and small intestine and promote urination. For the acupuncture points, we can choose from SI2, SI5, Heart 5, Heart 8, Stomach 39, REN 3, and Bladder 28. And we can use the draining needle technique. SI2, SI5, and Stomach 39 drain heat from the small intestine. Heart 5 and Heart 8 drain heart fire. REN 3 and Bladder 28 drain heat from the urinary bladder. As a relevant advice, food and beverages that have a hot energy should be avoided. Excess heat in the small intestine can be caused by the following pattern of imbalance: heart fire and stomach fire. In turn, it can result to urinary bladder heat conditions and heart fire. To summarize, full heat in the small intestine has its etiology in emotional problems like prolonged anxiety, stress, anger, and depression, being always on the go, and excessive mental activity. The underlying or accompanying pathology are stagnation of liver qi, stagnation in the lung, heart qi stagnation, heart fire blazing, damp heat in the bladder. Possible presenting condition, urinary tract infection. The symptoms and signs: mental restlessness, tinnitus, sore throat, tongue ulcers, discomfort and heat in the chest, abdominal pain, thirst, scanty and dark urine, painful urination, and blood in urine. The pulse is rapid and overflowing, especially in the front left position. Tongue is red with red and swollen tip and yellow coating. The treatment principle: we clear the heat and drain fire in the small intestine, stop abdominal pain, calm the shen, supplement the yin to clear heat. The acupuncture treatment: SI2 to clear small intestine heat, SI3 to clear interior heat, P9 to clear heat from the lower burner, Heart 5 to clear heart fire, Heart 5 to clear heart fire, Stomach 39, the lower Hosey point of the small intestine to stop abdominal pain, SI5 to clear heat and calm, REN 3 to disinhibit the bladder, REN 4 to regulate qi in the lower burner, and Heart 8 to clear heart fire. We needle with drainage. Thank you for your attention.
Let us go to etiology in Chinese medicine. The topic is effects of passions on activities of qi of Zangfu viscera. The passions cause injury to the internal organs principally by affecting their respective qi mechanisms and causing disturbances in qi and blood movement and actions. Rage causes qi to rush up. Rage can impel liver qi to move upward abnormally. Blood follows qi and rises abnormally as well. Clinically, we see such symptoms as flushed face and red eyes, or hematemesis, or even syncope. Excessive joy causes qi to slacken. Under normal conditions, appropriate joy relaxes mental tension, frees the movement of nutritive and defensive qi, and produces a happy and relaxing mood for the person. Excessive joy, however, induces slackening of heart qi and insecurity of the heart and spirit, leading to such symptoms as inability to concentrate and absent-mindedness. In severe cases, there may be delirium or mania. Grief causes qi to disperse. Uncontrolled grief can cause the dispersion or constraint of lung qi and damaging it. This can lead to depression of the mind, shortness of breath, a weak voice, fatigue and weakness, and lassitude of spirit. Excessive fear causes qi to sink. Clinically, there may be incontinence of urine and feces, spontaneous seminal emission, or even syncope. Fright causes the derangement of qi. This means that sudden fright causes the heart to lose its support, the spirit to lose its house, and thought to lose its abode. This is manifested clinically as palpitation of the heart and panic. Brooding causes qi to bind. Excessive pensiveness or brooding can injure both the heart, spirit, and spleen qi and constrain qi. It wears down yin and blood. Loss of nourishment for the heart spirit may lead to palpitation of the heart, forgetfulness, insomnia, and excessive dreaming. Stagnation of qi can lead to dysfunction of transportation and transformation by the spleen and the reception and decomposition of foods by the stomach. Food retention, abdominal distension, and diarrhea may result. From clinical observation, in the course of many diseases, wide fluctuations in emotion often aggravate the patient's condition or cause it to deteriorate rapidly. For example, in a patient with a history of high blood pressure, sudden rage can induce liver yang to become hyperactive. This in turn can cause the blood pressure to rise precipitously, leading to dizziness, sudden fainting, or hemiplegia with deviation of the eyes and twisting of the mouth. Heart illness is also often aggravated by the passions. Thank you so much for your attention.
Now let's talk about fear as part of our lecture on the emotions. Fear includes a chronic state of fear, anxiety, and sudden fright. Fear depletes kidney qi and it makes qi descend. The simple questions in chapter 39 says, fear depletes the essence. It blocks the upper burner, which makes qi descend to the lower burner. Examples of qi descending are nocturnal enuresis in children and incontinence of urine or diarrhea in adults following a sudden fright. So here we see a clinical picture of fear. So if qi rises, there will be palpitations, insomnia, and dry mouth, and incontinence of urine and diarrhea. This statement from the simple questions is interesting in that it says that fear blocks the upper burner, causing qi of the lower burner to descend. This would imply that fear does not simply make the qi descend, as we usually say, but that it also causes some qi stagnation in the upper burner. So here is a schematic diagram of the effect of fear. So fear can cause both qi rising and qi descending. Qi rising will bring about heart qi stagnation, and qi descending will affect the kidneys. Fear makes, so as a clinical note, we would like to repeat that fear makes qi descend by blocking the upper burner. Treatment of fear, therefore, should not consist simply of lifting the qi, for example, with do 20, but also in unblocking the qi in the upper burner using the points heart 5 and lung 7. Situations of chronic anxiety and fear will have different effects on qi depending on the state of the heart. If the heart is strong, fear will cause qi to descend. But if the heart is weak, it will cause qi to rise in the form of empty heat. This is more common in old people and in women, as fear and anxiety weaken kidney yin and give rise to empty heat of the heart, with palpitations, insomnia, night sweating, dry mouth, malar flush, and floating empty and rapid pulse. There are other causes of fear not related to the kidneys. Liver blood deficiency and gallbladder deficiency can also make the person fearful. Chapter 8 of the Spiritual Axis says, if liver blood is deficient, there is fear. The positive counterpart of fear within the mental energies of the kidneys is flexibility, yielding in the face of adversity and quiet endurance of hardship. To summarize, fear includes a chronic state of fear, anxiety, and a sudden fright. Fear depletes kidney qi and it makes qi descend. Situations of chronic anxiety and fear will have different effects on qi depending on the state of the heart. If the heart is strong, fear will cause qi to descend. But if the heart is weak, it will cause qi to rise in the form of empty heat. Liver blood deficiency and a gallbladder deficiency can all make the person fearful. Thank you for your attention.